Hello, my name is Wim van der Poel. I am Professor of Emerging and Zoonotic Viruses at Wageningen University in the Netherlands. We run a lot of projects on emerging zoonoses and also working by a One Health approach in these projects. As it comes to zoonoses, emerging zoonoses, it's very important that we develop a One Health approach. We need veterinary professionals and medical professionals to work together and also include other health-related disciplines in a One Health approach to cope with emerging zoonoses. In the Netherlands, we have developed a structure for these different disciplines to work together. We have a monthly meeting of all institutes in the veterinary field and in the medical field that work on zoonosis control. And in these monthly meetings, these institutes discuss what new zoonoses occur and how they can be dealt with. So we develop a One Health approach to control new emerging zoonoses. In these meetings, we also discuss what we've done in the past on zoonoses and how we have worked together to evaluate whether the approaches worked and also discuss new approaches or improved approaches. As it comes to a One Health approach, it's also important to involve other stakeholders. We report to people involved in the control of infectious diseases, also policymakers, to make sure that these people are informed and can support the One Health approach of the research institutes. When we talk about One Health, we prefer to name it Global One Health because in a One Health approach, we also need to think of prevention and we also need to think of international collaboration. A lot of problems related to health are international or need an international approach. For example, climate change and the loss of biodiversity really need an international approach and really need all stakeholders to support it to make this work. Well, EU can support or build more capacity to work on One Health approach and to develop a better One Health approach and also to improve the cooperation between the different institutes working on health-related research. Furthermore, EU can also support education in One Health and training in One Health, and also support research projects on One Health. In the Netherlands, we often talk about global One Health because in a global One Health approach, we are thinking of a systems approach in which we look at both negative and positive factors in the occurrence of emerging zoonoses. And in a systems approach, we can develop a total approach that can make a One Health approach work. For example, some factors are driving emerging zoonoses and some other factors are helping to prevent emerging zoonoses. And in a total approach, in a global One Health approach, you can look at those factors at the same time. So it's very important to cooperate and to have all institutes and partners involved to make a global One Health approach work. Thank you very much.